Good afternoon and welcome to Webinar Wednesday. We're excited to have over 300 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday t-shirt for answering this trivia question. Which city is hosting this year's Super Bowl? Answer now using the questions feature on your dashboard. While you're answering, I want to remind everyone that our ICE Imaging Expo takes place at the Hilton Scottsdale Resort in Scottsdale, Arizona from February the 9th to the 11th, which will bring imaging service professionals from across the nation for 3 days of learning, networking, and the latest advances in imaging. Registration is open and you can register for free by using the VIP pass in the webinar workbook, which you'll find in the handout section of your dashboard. For more information can be found at attendice.com. Also, a quick reminder that our Spring MD Expo, which will now be taking place at the Hotel Irvine, California, from April the 20th to the 22nd. Registration is also open for this, and more details can be found at mdexposhow.com. Okay, let's see who the winner of our Webinar Wednesday t-shirt is, and it is James Webster. Congratulations, James. Of course, the correct answer is Miami. On Wednesday, we'd like to thank our sponsor, Midmark. Midmark helps physicians and care teams deliver exceptional patient care with better equipment, smarter workflows, and integrated technology. Dedicated to making healthcare safer and more efficient through location and rules-based automation, Midmark RTLS provides patient and staff workflow, asset management, and safety solutions. For more information, visit midmarkrtls.com. Okay, and our presenter today is Tim Killmer, Information Systems Analyst at Billings Clinic in Montana. Tim, you may begin whenever you're ready.
Good afternoon, everyone. My name is Tim Killmer. I work at Billings Clinic in Billings, Montana. My slideshow, here we go. I've been working at healthcare and IT for about 31 years. I have been in Montana for 13 of those. I was the project manager for our nurse call system, which was Roland Borg, and our RTLS project with Midmark, and the secure communications project, which we're now using Volt phones. Billings Clinic is in Billings, Montana. We are the largest healthcare organization in Montana. It is a physician-led 304-bed hospital, level 2 trauma center. We have over 4,000 staff, and we're part of the Mayo Clinic Care Network. We have lots of affiliates and clinics around the region, so we do take care of quite a bit of area. So I wanted to start out with a level set of what is RTLS. I know a lot of you already know what RTLS is, but for those who don't, RTLS is real-time location services. It's used to track location assets and people in an indoor environment. It's effective tracking mobile equipment. Some people call it GPS for the indoors. There's many different RTLS vendors, and it usually comes down to finding out where is my stuff and where are my people. There's different levels of accuracy, and each organization will have to figure out what level of accuracy they need. My organization didn't have had different needs for different areas for levels of accuracy, which is part of what we had a challenge to come up with an answer for. Basically, we have different badges and tags that we put on people and equipment. as you can see on the left side. We track it via sensors in the ceiling and our wireless infrastructure, and then we can analyze the information we get back from that via software and reports. The potential for RTLS is that we help staff find equipment quickly. In healthcare, some of the biggest problems come up when they can't find the correct equipment at the correct time. It creates efficiencies. They can not spend their time walking the halls to try to find equipment. They can take their time in giving good health care. It also can save money over time if they don't have to overstock the floors with extra equipment because of equipment hiding. They don't have to buy additional equipment, and they can stay at the level that is needed. It also helps reduce preventative maintenance time, which if they can find the equipment faster, they can work on the equipment faster. So less time finding equipment, more time working on it. A few years ago, we updated our nurse call system to Roland Responder 5. We integrated with Midmark RTLS infrared sensors for our inpatient areas. We were using it for integration in with the nurse call system for basically call canceling. When the nurse went into the room, it would cancel the call. It would also report back the nurse locations across the floor. In the lower right, you can see the highlighted information gives them the room number or the location of the nurses. This was only in the inpatient areas, and we did it basically in every patient room and every 30 or 40 feet in the hallways to track the nurses and the CNAs. We started looking at asset tracking, and we asked the nursing department what they wanted to track and what their requirements were. And basically the nurses were relatively simple. They want to find the equipment they need to take care of their patients. They needed to locate devices across our main campus and continue to integrate with the nurse call system. But basically they didn't want to waste their time hunting down equipment. The biomed department was trying to make their PMs more efficient. They also had trouble. People would report equipment that was bad. When they went up there, they couldn't find it. They'd have to find the nurse. The nurse would tell them, I put it in the equipment room, and they can't find it because someone else took it. So all that wasted time of trying to find equipment was one of their main pieces of what they wanted to get out of an asset tracking system. They wanted to minimize the out of service time. They wanted to reduce the frustrating hunting of equipment, reduce potential clinic incidents of equipment not being available for people, improve the preventative maintenance, and speed up the critical asset recalls. So if a particular piece of equipment had a recall, they could find where those pieces would be and be able to track them down and perform the recalls or collect them and send them in. The administration leadership wanted to use the IV pumps. They didn't want to have to rent pumps at a great cost. Nurses wanted to reduce the time in searching for equipment also. This probably never happens in any of the other hospitals, but sometimes people would hide equipment, which doesn't do good for the whole system when that happens. Effectively use the equipment without having to rent or buy additional equipment. So we also had to look at our footprint. We do have 12 square blocks on our main campus. We have many buildings that equipment can go to hide. We have an outpatient surgery center that takes equipment. We have infusion center and our cancer center that can take equipment. And so we needed a solution that would cover a little larger area than we could kind of keep track of. We also had a robust Cisco wireless network. We put in Cisco wireless before that, and part of that is that Cisco can track tags. In the lower right, you can see different tags that are tracked for location of where they are, but that information can be used to locate equipment when we don't have the infrared sensors to find the location of them. The big thing that comes into play when designing an RTLS system is accuracy. Do you want it down to a specific room level? Do you want to just have general knowledge of what department it is in or what end of a unit the equipment is? Or do you want specific bed or chair the equipment is at? An infusion center might have a large room with multiple chairs that you may want to know the specific level of which chair it was at. Other people, just the general information that it was at the infusion center would be good enough for them. But you have to decide what level of accuracy you'd want. Basically, the higher accuracy involves more sensors, which equals more money. So always trying to balance what you need, the level of accuracy you'd like, and of course the expense of that. In our organization, we wanted different levels. In our inpatient areas, we wanted room level accuracy. We wanted to, the integration with the nurse call system required that we at least were down to the patient room level. And so we designed it in that area. In our, the rest of our campus and remote clinics, we more wanted the general information. We just wanted to know that an IV pump was taken to one of our outpatient clinics, or people could find something located in the infusion center. The decisions we made, as I just said, were room level accuracy for the inpatient areas, chair level accuracy for cancer center infusion area, and then general location for the rest of our areas, outpatient areas and clinics. One user interface to see them all, so we didn't want to have to go between multiple systems to have our high accuracy areas, and another one for the general location interface. We wanted one interface to see that. We also wanted to leverage our investment with all the sensors that we had already bought with our nurse call system. We looked at several vendors. They have different technologies. There's lots of different ways of tracking the tags, infrared, Wi-Fi, ultra-wideband, passive RFID, active RTLS. There's many ways to set up the power in the sensors. Do you want more work wiring it up hardwired, or do you want to use batteries? Do you want to plug it into outlets? There's many different options with different vendors. We decided that we didn't want to mess with more batteries. We wanted to have it hardwired, which was more work up front, but in the long range, in the longer term, we believe it's a good decision not to have to do all the maintenance on all the different sensors. We decided to partner with Midmark RTLS, which was Versus when we went with them, but they are now Midmark. The implementation with Midmark and our integration partner, Beacon Communications, produced a plan. We leveraged our investment that we already had. We leveraged our Cisco wireless environment, and we were able to, we could use the user interface for IR and wireless asset tracking with their utility. So basically, we use the infrared sensors that you can see on the left side. Those just, for us, we mounted them in the ceiling. They come out with a fairly wide angle that you do have to see a direct line of sight to the infrared sensor. And then we also had our wireless infrastructure that covered our clinic and outpatient areas and more of the outlying buildings. This is just saying that it's a very low angle that the sensors go at. When you're designing how far away you want sensors, if the tags are at a certain height on equipment, you don't want to have the height where they have dead spots in between. You want to have it so that the height are overlapped. So depending on where you place the sensors determines how far you want your IR sensors apart when you're designing them. We got our tags and tagged the devices that we wanted to track. We need adapters on equipment. The headboard of the bed detaches, so we didn't want to put the tag on the headboard because that potentially could be moved from bed to bed. We did get a clamp that would go on the side rail so that it could be seen there. You can see it in the on the side of the bed there. We also didn't want them to be in the way, and if you're tracking something like a wheelchair or something, you shouldn't put it on directly on metal. So you have to have various adapters to tag the different equipment. When we looked at the pumps, we did want to make sure we tagged each piece of the pump, not just the main piece. We did want to make sure that we tracked different modules. We also still had the people badges, the clear view badges that you see on the right that the nurses will wear, and so we can track those also. This is Enterprise View, which is the utility we get. We can have different views on this. This is an overall equipment view. It gives us, if we're quickly checking, we can see the different types of equipment have different icons on the left side. We can see what their tag number is. We can put in our asset IDs. So depending on what we're looking for, we can use any of those in the search. It tells us the current location. We have usually the unit and the room number. If it's a hallway, all the ones that we track via a Wi-Fi zone have Wi-Fi at the end. So the annex second floor Wi-Fi is an administrative area where it's one of those areas that we wouldn't think that a pump should ever go to, but evidently when we took this picture, there was a pump on the second floor of our annex. But it's always interesting where equipment goes to hide, and someone brought it for a training class, and it stayed in a conference room, and so you can now track down some of that equipment. We also can tell how long the equipment has been in a location, the serial number for tracking, manufacturer and model of all our equipment. We can also do filters. Instead of that big long list, we can say, just show me the equipment in a particular unit. So we can look at the equipment based on what is in ICU, for example. It also, that filter also works on maps to show what they look on maps. This is our second floor ICU. We can show the individual rooms where equipment is located. If biomed is looking for a particular piece, they can filter on that serial number or the asset number to find it. They can, when this is in real time, the nurses will move around. We can, this view has been very useful for nurses and biomed staff to track down equipment. Everyone loves a picture and seeing where equipment is being kept. This is another room or another unit, our orthopedic and neurology unit, and it gives another example of how we can see the different equipment in the different rooms. We also decided to try to be a little bit more proactive with our pumps, especially. It'd be nice to know, the nursing leadership wanted to know ahead of time if they were running low on equipment, and the power levels show when what units have a low number of pumps, what are at what they expect, and if they have too many. It will send emails when a unit is critically low so that they can try to find them before they need them, which usually makes everyone very happy. This is a power level screen, so we have it based on units. The color codes show blue is that you're above your high level. Yellow is that you're within from your power level to the high. So that is a good level. If it's just the background color, it means you're right at your power level. If you are red, it means you're below your critical low. We also have the notifications turned on, which can be an email, or you can have a pop-up on a screen that would pop up on their screen when they are alerted. So people ask, where does our equipment go? They never thought the equipment should go into certain locations. Now we know exactly where the equipment goes, and when it goes into the Wi-Fi areas, we can hunt those down and bring them back to where they are useful and not collecting dust and not being used and not being just causing troubles where no one can find them. A biomed tech was asked to look at some broken equipment. When he went up to the unit, he could not find the pump. He used Enterprise View and saw the last location was the loading dock. And what it turned out to be was another tech had seen the call. He didn't mark it as he was taking care of it, but he had already found it and knew it was broken, and he already was packaging it up at our loading dock to be sent back to the vendor for repair. But rather than spending the next whatever amount of time trying to hunt down that pump again, he was able to see that it had been taken to our loading dock, and he didn't have to worry about it anymore. He could yell at his coworker for not saying that he took care of it, but at least it minimized the time he had to spend on trying to hunt down that equipment. Another issue we had, an ICU patient that had a pacemaker box attached to them. They were moving the patient to our cardiovascular unit, and somehow in moving the patient, the pacemaker box was disconnected and misplaced. The patient was having issues. His rhythms on his heart were not working correctly, which is why he needed the pacemaker box. They sent 6 people back down to ICU to try to find the box and get it back as soon as possible. When they got to the room, they couldn't find the pacemaker box. It wasn't in the room. It wasn't in the linens. They checked the equipment room. It wasn't there. They were not happy that they couldn't find it. They got another one and took care of the patient, but the cardiologist was not happy at all that happened and asked us to put tags on all the pacemakers. With the tags on the pacemakers, they now can find the equipment when they need it, and to my knowledge, they haven't had another incident like this. Another thing that I talked to the manager of the cardiovascular unit, and they said with the number of boxes that they had, now that they can find them rapidly and know how many are being used, they've increased their number of patients that have needed pacemaker boxes with the different procedures, but they haven't had to buy additional pacemaker boxes with the increased usage because of asset tracking, because they knew where the equipment was and they didn't have any hidden and could use the equipment that they have without having to buy additional equipment. The nurses always still have the where did my pumps go? The infusion center was notified. The manager got in and they saw that they'd been raided in the night before or sometime overnight, and several of their pumps were gone, and they knew that they were going to have so many patients coming in and they didn't have enough. But instead of going around the unit and counting them and trying to figure out how many patients they had, and rather than having the patients have to wait until they had the equipment, they were able to proactively go out and get the pumps before their patients showed up, and they had enough pumps then to take care of all their patients ahead of time, thanks to the power services. We also, for preventative maintenance, yearly Biomed would take their beds, and our organization has a policy of if a patient's using the bed, that we don't ask them to get out of it and get into another bed if they're using it. So for preventative maintenance, so they would leave beds that patients were in, which is the majority of the time. But when they came back in a day or two, the patient had been discharged. They looked at the bed, and the bed isn't even the same bed in the room. The bed had been moved somewhere. They don't know. They have to start their hunt all over again. The first 100 or whatever, the first half of the beds that they looked for, they relatively could find those relatively quick. But when you got down to the last 50 or 100, they were hard to track down. And with asset tracking, it now takes half as long to do the preventative maintenance, and they have more time to work on other equipment. We also have reports that we can schedule and can help with the different assets and get information where people were and quality measures and so forth. We can check where equipment was moved, the last location of equipment. We also had, we regularly do our asset low battery report, so that we can replace batteries in the tags before the batteries run out, and you don't get any information from them after that, obviously. So we swap those out regularly, and we can also use the preventive maintenance option to, if you have several people working on a PM, they can track the equipment and mark that it's been maintained, and a group can be in different places and not work on the same equipment that someone else has worked on. The things we learned in our implementation were that the initial education is very important. We know the equipment exists and where to find it. Teaching them how to use the different utilities and the filters is very important. We also had to come up with, people started thinking they wanted to tag every piece of equipment that they have, and obviously with cost restrictions and some things don't make sense to track. Some people wanted to tag some oxygen equipment and masks that didn't make sense and got in the patient's way. And the masks were very cheap, or not very cheap, but relatively cheap, and didn't. So we came up with an approval committee that people can say if they want a particular piece of equipment tracked. It goes against a committee where they can evaluate the pros and cons of doing that. And then we also learned that as you get turnover and new staff coming on, the continuing education as part of the nursing onboarding process was important, and some in-place training for the biomed staff on how to use the asset tracking software and tagging. RTLS increases equipment utilization. It eliminates the budget redundancies and decreases due to we don't have to have the rentals. We reduce our loss if something is stolen or taken out of the facility. We know that it was taken out of the facility. We don't spend our time hunting it down. Sometimes it shows up at a remote clinic, and we can figure out why it was taken there and if it should be brought back, and so forth. It allows the nurses to have the reassurance that they need to have the equipment they need without hoarding. So the hiding of equipment has gone way down. They know that their unit has the amount of pumps that they need, so they don't have to hide them for worrying about that they have equipment, or they remember the one time that they didn't have a pump available when they needed it, so they don't have the need to hoard the equipment. It helps them get the equipment when they need it, improves the staff work environments, eliminates the frustration. Nothing nurses seem to get more bothered by than is the frustration of doing things that are not nursing, hunting down equipment, things like that. They want to spend their time taking care of the patients. It will give a large area that the asset is in. So we did learn that with Wi-Fi accuracy, we covered our whole operating room surgery area, and we ended up breaking that at least into some smaller zones. You do have some limitations with the Wi-Fi tracking that is a little bit more of that general location area, and sometimes everyone wants, or at times they want higher accuracy, but we do just give that it's in the west side of the OR, so it sometimes a lot of equipment will go from the floors and be brought into the OR area, and then it doesn't make its way back to the floors, and so equipment was getting lost in our OR area, and so that's something we're looking at to maybe go to infrared in the OR area to get that higher accuracy. We can have short-term delays in locating information about an asset as they move. If equipment is on the move, sometimes the data is slightly delayed in the Wi-Fi areas. And so if equipment was being moved by someone, we track a little bit behind where they were exactly. The IR sensors are very good at giving the real time, but sometimes the Wi-Fi is slightly delayed. The users don't always understand the accuracy, so they think they have room accuracy or chair level accuracy in their area, and they think it's in the whole organization, which gets back to our education of what their expectations are. It's great to find the general location in a large campus and remote sites. So many times they've said, equipment should never go to that location, and so they would never even look there. But it turns out now that we're tracking it, it does go to some conference rooms or administrative areas, and they can track that down and find out where and why they went there. By mixing up the IR and the Wi-Fi sensor networks, we got the best of both worlds. We didn't have to buy a lot of infrared sensors and put them throughout our whole campus. The Wi-Fi was already there and was able to give us the general location of those areas. We do have the room level accuracy in our inpatient areas and general location for the rest of the campus without the excessive costs. We are looking into security on the staff button or badges. They do have a button on there that in today's world, there are situations when the nurses get into a situation where they might need assistance from security. We're looking at implementing that system that when they press the button, it would notify security or other nurses on the floor of that person and what their location was and get them help. We're also looking at different workflow improvements, and Midmark has a lot of different options, everything from self-rooming for patients to patient management, environmental services, challenges to get rooms. We also are looking at some data gathering in real time for our emergency department, getting the time to room and time left in room, time to doctor statistics so that they can appropriately staff the emergency room properly and make sure that our patients are not ignored and left in rooms for too long. Our last thing we're looking at is hospital patient flow and bed tracking. So if we did track our patients, that would be something else that we could leverage our RTLS system for. RTLS has been good for us. The nurses can generally find the equipment they need for their patients. Biomed can take care of the equipment more effectively, and administration is happy that we didn't have to buy and rent additional equipment. And so with that, that was my presentation on our implementation of RTLS for Billings Clinic. And if there are any questions, I can take them now.
Great, thank you so much, Tim. Yeah, we have got quite a few questions. So first one is, what is the biggest problem RTLS has solved for you?
I would say that it is finding the equipment at the right time and reducing the amount of hunting for equipment. Just walking around some of the larger units was taking a lot of their time, and now they can go to a screen and be able to find where there's extra equipment.
Okay, and will you use the Wi-Fi network to cover your larger campus for workflow or staff security?
Where will we use it?
Will you use it?
Basically, yeah, we're currently using that in basically everywhere except for our inpatient areas. So the inpatient units are using the infrared, and the Wi-Fi is being used throughout the campus, our remote locations, in the different outpatient areas.
Okay, and how did you decide on PAR levels for each area?
We talked to each of our units has a manager and a clinical coordinator, and we talked to them, and it was they came up with a number that they thought was good, and then it does go back and forth that they were getting notified every other day that they were low on equipment, so maybe they need to lower their low level. So we went back and forth with them, and then over time it settled on equipment where was appropriate for each unit. But each unit does seem to have a different flow of equipment, and some of the ones that are related to surgery have more in and out. The ED, our emergency department, always hooks people up, and then the equipment goes up to the rooms. And so getting the equipment brought back to the ED was also a little bit more important for the ED to make sure that they had equipment than some of the inpatient units were. But it also allowed the emergency department to look at the PAR levels and see which unit had an excess of pumps. So that helped them out with knowing where to look for additional equipment.
Okay, what key stakeholders were involved in your purchasing process?
We had our VP of facilities, our chief nursing officer. We had 2 or 3 biomed staff, and a project manager in the IT area, and those were the key people that we used for that.
Okay.
That was on our core team.
Okay, that's good. We have quite a few questions about tags, so I'll work through them. Do you have problems with the tags getting knocked off equipment?
Not too much. I mean, there are the glue or the 3M tape that holds them on. If you're choosing the position on the equipment is very important too. Midmark did help us with trying to find good locations and good adapters. When we look at the when it's just glued on, if it's in an area that doesn't get bumped and hit very often, we have a much better, we don't lose the tags as much. Or we really haven't lost too many tags that I'm aware of. And then like the beds, we do have an adapter that goes around, and that one is more closer to the patient, and it is locked on there pretty good, that we have not had very many come off. But anyway.
Okay, so how much time does it take for dealing with low batteries for the tags?
They do last under normal situations. They will last 2 to 3 years. So we have 1,500 assets that we track, and so after a year and a half or so, we started noticing that we were having more regular, and I think they go out once a week and do try to get everything that's on that report. So we have an automated report that they get emailed once a week, and then they make a pass through the inpatient areas to try to get those batteries replaced. So it's I'm not exactly sure how long it takes them, but they do it once a week, and I'm not sure how long it takes.
Okay, and slightly different question for tags. How many tags get removed on purpose to hide, in quotation marks, the use of equipment?
I'm not aware of any. The only issue we have had is on some of the equipment racks in the equipment rooms. Some of the shelving was solid shelving, and they put it on the bottom shelf and it did not have a direct line of sight. The tags do have a keep alive with if they still see Wi-Fi, and so they do still report that they're alive and working. But we also noticed in some of our equipment rooms that we put the our IR sensor on a wall on the opposite side of the wall, so it could see into the shelving easier. But we don't hear too much of nurses prying off the tags because they don't go back on very easily. Then you have to get a new glue strip. So.
Okay, so for your Wi-Fi tags, what is your beacon rate set at?
I'm not sure, but I believe it's every 5 minutes, but it also has a motion sensor in it. And so when it is moving, it reports more often. But otherwise, the keep alive is, I believe, every 5 minutes.
Okay, and the last one about tags. Were the staff okay with wearing tags?
Well, again, with the education, when you're not trying to do reports of so-and-so took a 32-minute break when they were supposed to have a 30-minute break, or the question always came up, is it going to track when I'm in the washroom? And once they learned that we weren't trying to use it to chastise them or to catch them doing something, we tried to reinforce the positive sides of it, that it did help them with canceling calls when they went into a room. We do have occasionally when there was various situations and they were wondering why someone didn't come into a room. In our reports, we do get information of when the nurse entered the room, when they left the room. So it's helpful to corroborate their accounts of what happened in a incident. But once the nurses knew that we weren't trying to nitpick, how they were taking their breaks or spending too much time in the break room or whatever, they seem to enjoy the benefits of them. When a doctor comes on the floor and they need to talk to a particular nurse, it's nice to be able to find them right away instead of looking in all the rooms and trying to figure out where Mary is. It's nice to have that information, and generally everyone's happier without I don't know where she is, you'll have to come back later, or she'll be back around soon. So in general, they've been happy. In general, though, people enjoy it when they're trying to find someone. They don't always enjoy being found, but I think that's just human nature. So
Okay, that's great. Thanks, Tim. We're actually coming up to our hour. We still have lots of questions, but as time is up, I will be sending them to Tim to answer offline. So please be patient. He will be in contact with you as soon as he can. So thank you, Tim, for a great and informative webinar. And thank you again to today's sponsor, Midmark. Just a quick reminder that the post-webinar survey and certificate process is automated. So the survey link will be included in the follow-up email, which you'll receive in about an hour's time. Once you've completed the survey, you'll be able to download your certificate immediately, and one lucky attendee will win an Amazon gift card just for completing the survey. If you have any questions, please contact us at webinar@mdpublishing.com. For more information about all our upcoming webinars, please visit our website, webinarwednesday.live. So thank you once again for joining us today. Enjoy the rest of your day, and we hope to see you next time.